Hi, I'm Dr. Lily, and today I would like to talk to you about magnesium. Now, magnesium is one of the most essential nutrients in the human body. In fact, it's been known now for it to participate in more than 350 different biochemical reactions within the body. So many different body processes. And unfortunately, for many reasons, many people throughout the world are magnesium deficient. Now, this may be because they're eating foods that are deficient in magnesium because of the poor soils, or they're simply not eating those foods, or they may not be absorbing those foods for a variety of different gastrointestinal disturbances and dysfunctions, or they might have a high requirement for those foods because they suffer with certain conditions or perhaps need to take certain pharmaceutical drugs which deplete magnesium. But for whatever reason, it is a very, very important nutrient, and we can find out very easily ourselves whether we are magnesium deficient. One of the first reasons or first questions that I ask my patients is, do you suffer with eyelid twitches? Now, eyelid twitches seem to be so bizarre, and they say, oh, okay, it's just I suffer with them when I get tired. But what you realize is once you're not deficient in magnesium, you don't suffer with them. So they're actually a sign that your body is telling you that you need some more magnesium. As well as the eyelid twitches, could be muscle twitches around anywhere in your body, cardiac palpitations or heart palpitations in the absence of heart disease, feelings of tightness or cramps in your legs or feet, and particularly restless legs at night. I'm sure all of you, if you know someone, if you haven't experienced it yourself, restless legs at night, it can be quite debilitating. And the other common thing that comes is with magnesium deficiency is muscle spasm. And people can just feel that in so many different ways, as neck pain, which translates into headaches or back pain, or even just other twitches around their bodies. So again, magnesium is a natural muscle relaxant. Calcium, one of the jobs of calcium is to contract the muscles. Well, magnesium's job is to relax the muscles. So if we're magnesium deficient and we suffer with anxiety, then it's so important to be able to bring up this level of magnesium, because no matter how much psychological help we may be receiving or help through other therapies, if our nutrients, our body is deficient, then we're just unable to relax. So anxiety is a common symptom of magnesium deficiency. Other conditions also include stabilization of blood sugar levels. Gestational diabetes as well as type 2 diabetes can respond to magnesium supplementation. And in the same way, with smooth muscle relaxation, we have smooth muscles in the arteries. And so, of course, if we supplement with magnesium, or at least bring up our magnesium through foods, then we can perhaps lower our blood pressure. And certainly in the cases of preeclampsia, which is high blood pressure associated with pregnancy, then that's how we treat it, is through giving intravenous magnesium. Other conditions that may respond to magnesium, as I said before, is anything to do with the musculoskeletal system, so back pain, neck pain, muscle aches, joint aches even, going to the point of fibromyalgia, even chronic fatigue. Our bones need magnesium just as much as they need calcium and boron and zinc and many other minerals in order to function at their optimum. And probably most importantly is hormone imbalance. And a lot of the patients that I see are suffering with what we would call as estrogen dominance. So we have a higher level of estrogen than we do progesterone, and that will result in the so-called PMT that everyone seems to know about, which for some women can be up to 2 weeks before their period, and can be spending half their lives being under the curse of low progesterone, which can result in headaches, in mood swings such as anxiety or sadness or anger, aggressiveness, irritability, breast tenderness, sinusitis. There's a whole range of symptoms which magnesium can help with, in combination with other herbs and other nutrients. So food-wise, what can we find magnesium in? Well, primarily it's seeds and nuts, almonds, walnuts, cashews, pecans, for instance, green leafy veggies, green peas, lentils, bananas, those sort of foods. Again, it depends though upon our state of absorption, our state of our gastrointestinal system. Being a nutritional doctor, of course, it's extremely important in terms of your nutritional status and your health status as to how the state of your gastrointestinal system is. As far as supplementation is concerned, if there are symptoms of deficiency, then often I'll say to my patients, well, perhaps you do need to supplement, often for 3 months. I tell my patients some effect first month, more effect second, and maximum effect third. So that they're going to start to experience the reduction of those symptoms of deficiency over those 3 months. And in the case of blood pressure or blood sugar, often we'll repeat those levels after 3 months, and we can see what this supplementation has done. And hopefully after that time, they'll be able to use foods only as a regime to keep their levels up then once you replace that deficiency. But in some cases where perhaps people have like fully established diabetes or uterine fibroids, where there's structural conditions, well, these people might have a higher requirement for magnesium throughout their lives. And so this is why it's really important to consult with an integrative health practitioner who can help you with these doses of magnesium, because there's many different sorts of magnesium. There's chelated forms, which are often easily the most absorbable forms, but then we have things like magnesium oxide, which helps with constipation in particular, or magnesium orotate, which can help with symptoms of costochondritis, which is inflammation of the costal cartilages and ribs, so that you get tender ribs or painful ribs when you take a deep breath in, or cough, and it's not associated with a flu, so it's not pleurisy. So there are many different types, and it is important, as I said before, to consult with a practitioner so that you know what you're doing. You're taking the right form of magnesium and for the right length of time. Thank you.